Your income level doesn't just determine what you can buy. It determines how you experience health itself. Most people think that health is just a matter of discipline, that if you eat right, you go to the doctor, and you exercise, that you'll be fine. But that's just patently not true. Your health strategy at $35,000, $75,000, and $100,000 or more isn't just about the choices that you make for your health, but it's about experiencing a completely different reality. If you pick the wrong approach for your income level, you'll either waste money on things that actually don't matter, or you'll miss out on the biggest opportunities available to you at your income. Let's break it down now. If you're making $35,000 a year, your monthly take-home pay is about $2,500. At this level, health isn't about what you do. It's about what you can afford to avoid with the means that you have. For many people here, it's not about optimizing longevity, but it's about avoiding total collapse. A single medical emergency, a bad flu, or a trip to the urgent care can mean debt, joblessness, or even worse, homelessness. This isn't a game of living your best life. This is survival, and in survival mode, you need ruthless efficiency in the choices that you make for whatever you prioritize, in this case, your health. The biggest mistake that I see at this level is people overspend on habits that they can't sustain, or they ignore their health completely. The truth is, at this level, the best health strategies are the simplest. For each health plan, I split it up into 4 sections. The first is healthy eating. The second is movement or going to the gym. The third is figuring out how you're going to get covered for healthcare services. And the fourth is mental health. So with that said, let's dive into the first one, which is healthy eating. At $35,000, you need to figure out what foods can you eat that are both cheap and nutritious. So figuring out how to eat healthy like your ancestors is a good starting point. First, when you're looking for food, forget overpriced superfoods or organic marketing traps. If it had a face or it grew from the ground, it's probably good for you. The best budget-friendly foods that are staples in my pantry are beans, lentils, eggs, frozen vegetables, and frozen fish. The second thing that I would suggest is figuring out how to cleverly meal prep these foods into stretching it out for the week. So this would mean that a $10 meal plan beats impulsive takeout or whatever else you want to spend your money on. The third part that I would work on is a mindset shift from figuring out how to avoid ultra-processed foods. Thinking of it not as inexpensive food, but overpriced sickness is a good way to reframe how you should think about fast food or other takeout. Although it's cheaper in the moment, later on it's going to be a lot more expensive if you're going to be going to the doctor and having to be treated for things like high cholesterol or diabetes. The second part of the $35,000 health plan is around movement. And this part is particularly interesting to me because while people say that they need a gym membership to get strong, it's certainly not true. The first thing that I would suggest at this level is just walking. Walking is free cardio and you don't need permission or a gym membership to do it. The second purchase that I would make if I was going to the park or walking in the park is resistance bands and looking up a very easy bodyweight routine that you could do at the park, because that allows you to get moving and introduce some resistance training to your exercise routine without having to break the bank. Most parks have pull-up bars or a playground where you can do the calisthenic movements that you need to do in order to build muscle, and I think it's a really good alternative way to get some free training in order to meet your health goals without having to spend a dime. Finally, if you're trying to gain weight on a very bare bones diet, focus on how you can get cheap sources of protein. For example, lean cuts like chicken or fish allow you to get in that protein as well as having enough of it to gain muscle instead of spending that on expensive protein powders where even though there's more protein in it, it's really hard to justify that expense without having to take away from other parts that you need to spend on in your life. The third part of this plan is getting healthcare services. The healthcare system is confusing, and in order to make sure that you can get free or low-cost care, you really need to figure out where you can find it. Most people who are making $35,000 a year probably avoid doctors because they're afraid that they can't pay it, and a single medical emergency, like I said, can drive them into debt or joblessness. The problem is, if you avoid the doctor for long enough, you might be having medical issues that fester on, and are more expensive to treat later on than currently. So in order to do that, here's some free resources that you can check out in order to figure out what you can qualify for and the free services that are already available in your community. First, if you have an insurance plan, there are certain preventative services that the Affordable Care Act has made free that don't require any copay in order to make sure that other services are covered. For example, if you're an adult, then free preventative lab visits as well as a yearly physical is covered without a copay according to the ACA. So make sure that you're getting into the doctor at least to take advantage of that free yearly physical. Obviously, check your plan documents to make sure that this is the case, but because the ACA, all plans should be covering it without a copay. The second thing that I would look at is community health centers. These are federally qualified health centers which offer free to low-cost care for people that need it. For example, if you need a screening, they usually have community health fairs where you can get that screening done, and they'll let you know about further options that you can do to get free or low-cost care based on your insurance eligibility as well as your income verification. The third thing that I would say is to ask for generic medications. They're usually 80 to 90% cheaper than the brand name medication, and it's an easy way to score some savings when you're asking for health services or the pharmaceuticals that you need to treat those health conditions. The fourth thing I would suggest is that you might qualify for Medicaid. And this can help you a lot when you're looking for care because a lot of Medicaid plans are very generous with the benefits that they give. And a lot of the care that you may need might be coming at a low cost or even a cost that's applicable to your income based on different gradations. The fourth part of the $35,000 health plan is about mental health. And I debated including it on here, but I realized that it wasn't optional, but foundational to the work that we do on other parts of our health in our physical world. When you're living paycheck to paycheck, stress isn't just a feeling, it's a chronic disease. There are a few ways to combat this. One is to use free therapy alternatives like crisis text lines. The second is investing in free meditation apps like Insight Timer or Smiling Mind. The third is more abstract, but it's about structuring a life that you feel good about, whether it's focusing on sleep, focusing on social connection, and focusing on spending time outdoors. At this level, any time that's not spent on improving your health should be focused on increasing your income. The brutal truth is your health is capped by your income level, and until you increase your income, you're not going to break out of survival mode. At $75,000 a year, you're not fighting for survival anymore, you're fighting for efficiency. Here's the trap. People assume that when their income increases, their health improves as well. This isn't the case. They start spending on trendy nonsense which might not move the needle for their health, and this leads to lost income without actually being more healthy. The first thing is nutrition. With $40,000 more of income, you should be able to get the high quality produce that you weren't able to afford in the previous health plan. But in order to upgrade strategically, not blindly, you need to take a few factors in mind. First, you should be able to buy organic wisely. There are a few foods called the Dirty Dozen which have more pesticides and chemical contaminants than other foods. So look for those first when you're buying organic versus other foods. The second is if you don't have time to prep meals, there are certain meal prep services which are cheaper than others. For example, Every Meal has meals as cheap as $5 a meal, which could be a good alternative versus other ones which can be $7 to $10 per meal, and obviously better than takeout, which could be $15, $20 plus in order to get a hot meal. The third part that I would suggest is if you're trying to stick on a healthy diet, it has to be tasty. So investing in kitchen equipment, which you can use to get meal prep done quicker, should be of utmost priority. For example, if you get an Instant Pot, you can create rice, vegetables for the entire week without having to actually cook it. You just need to set it and forget it, and then 5 hours later, you can come back to a great meal for the rest of the week. Moving on to fitness, you should spend only where it actually matters rather than focusing on all of the different types of fitness that you can get involved in. The first thing I will say is a gym membership is only valuable if you're using it. If you're not using it, or you realize that over the past month you only went a couple of times, then you should be able to cancel it without having the guilt of I'm not using my gym membership. The second thing I'll say is that group fitness classes provide accountability as well as form correction. They're worth paying for if you think that you need that in order to get yourself to the gym to use your membership. The third thing I will say is that an Apple Watch or Fitbit can be great investments into your health if at this level you find that you need a little bit more of that tracking and the optimization that you have the room for when you're spending more on your food, your diet, or other parts of your health. For medical services, this is where I would focus on the optimization of using different accounts to pay for your health. The first thing is your HSA or your FSA. They can save you thousands of dollars in taxes if you play them right, so make sure that you're maxing them out if you know how to use them. The second thing I'll say is that extra preventative testing, for example, vitamin D, other cholesterol tests like LP(a) or ApoB, can be very important to talk about with your provider, because making sure that you are more proactive on some of these latent risk factors can help you later down the line instead of being reactive when you are diagnosed with high cholesterol or coronary artery disease. The third thing I'll say is still looking for efficiency and saving money for medications is really important. GoodRx and other coupon saving sites can help you, especially when you're trying to pair that with insurance to get the best rate for the pharmaceuticals that you may be prescribed. The fourth part of this health plan is about mental health. This is where you need to invest before you burn out in order to make sure that you have the right foundation for the other parts that you're trying to improve for your health. The first part is therapy apps like BetterHelp or Talkspace, which offer really good accessible medical care, and it can even be asynchronous where you're chatting with a therapist and figuring out when you can meet in order to piece it into a busy schedule. The second part is as you get better insurance coverage with a better job, you can focus on figuring out whether insurance can cover some of that therapy cost so you're not paying as much out of pocket for that specific session. The third thing I'll say, maybe mindfulness or executive function coaching can really help you perform not only professionally but also personally in other parts of your life, trying to optimize some of the things that you can do with the newfound income that you have. The bottom line is with the $75,000 health plan, it's really important about not wasting resources so that you can improve efficiency and also hopefully improve income in the long run, having the health part of your life taken care of. At $100,000, you are in a different game. Now you can afford true health optimization, but most people spend money on wellness scams instead. The first part of this health plan should be about nutrition being custom built to your physiology. In order to do this, you should meet with a registered dietitian, understand their recommendations, figure out based on your metabolic screenings, your food sensitivity testings, and other blood work, which diet is most appropriate for your biomarkers. Then you should focus on high quality ingredients, which you already had at the $75,000 health plan, but just upping the ante and focusing on better lean cuts of protein and making sure that they're grass-fed and not having any other antibiotics or other contaminants in this meat. The second part of this plan is around fitness, where you're moving beyond the general advice that people usually give. The first is you're working with a physical therapist or a personal trainer in order to have biomechanical gait analysis done or correcting imbalances in your flexibility and stability in order to make sure that you can perform in the gym. The second is you're focusing on advanced recovery tools, whether that's sauna, cryotherapy, compression, in order to make sure that you're recovering from all of the workouts that you are conducting. The third is you should focus on figuring out the right lab tests to aid your biomechanical analysis. For example, if you're going to a sports and nutrition lab, you should focus on VO2 max testing or DEXA scanning in order to make 100% clear about how your training is impacting your physiology. The third section of this $100,000 health plan is tailoring healthcare services to you. So this looks like a concierge medicine doc who has same-day access, direct access to you, so you can focus on making sure that you are healthy as possible and getting an appointment quickly. The second service that a lot of the people at this level usually do is executive physicals, which find problems early and they're a head-to-toe scan and meeting with very different specialists in order to make sure all of your boxes are checked when doing a physical rather than just meeting with your primary care provider. The third part about this plan is that you have healthcare advocates which follow up your scans for you rather than you having to figure out every single doctor that you have to go to after a certain issue has arisen. Finally, for mental health, this part is about performance level optimization of making sure that if there's any deviations from the norm, you should figure out where I can improve. The first thing is with this type of spend, you could probably afford top tier therapists rather than just a general psychotherapist. You should be able to focus on specialists that treat the various issues that you're going through and have experience with people at your level who are trying to spend as much as you do. Finally, other things at this level that you can spend on because you have the discretionary income is wellness retreats where you take a few days to go to a rural area and really disconnect from the decisions that you're making from a day-to-day basis and really connect with what makes you tick, finding your purpose, and other things that you couldn't do if you weren't spending this much on your health. The best health strategy isn't about spending more, it's about finding the right strategies to use at your income level. If you're in survival mode, you have to get ruthlessly efficient. If you're at the mid-level, you should be cutting waste. And if you're at the high level, then you should be optimizing performance. No matter where you are, your health is your biggest wealth multiplier. So starting today, make sure that you're using the right strategies for your health and the rest will follow. No one is coming to save you, but with the right strategies, you can save yourself.